السلام عليكم ورحمة الله وبركاته. الطالب ذو الفقار علي حسين، جامعة بابل. اليوم موضوعنا prosthetic surgery. Is that part of the oral and maxillofacial surgery when surgical procedure done to improve the condition of the oral tissue to enable removable denture to rest on a sound base free from marked bony undercut with no interfering muscle attachment, flabby soft tissue excess or hyperplastic oral mucosa. Aim and objective of the prosthetic surgery. The aim of the prosthetic surgery is to prepare the soft and hard tissue of the jaw for comfortable prostheses that will restore the oral function, aesthetic, and facial form. Restore function of the jaw, mastication of food, speech, and swallowing. Preserve or improve jaw structure. Improve the patient's sense of well-being. Improve facial aesthetic. Eliminating pain and discomfort arising from ill-fitting prostheses by surgically modifying the denture-bearing area. Improving the denture-bearing area for patients in whom there has been extensive loss of alveolar bone. Inserting endoosseous implant into the jaw. Improve the condition of the residual ridge or the overlying soft tissue before denture construction and therapy. Improve the retention and stability of the denture. Insert into endoosseous implant within the bone to replace missing teeth or to improve removable denture stability or retention. Correct skeletal discrepancy in the relationship of the jaw. Bone surgery. The first one is the alveoloplasty, the removal of bony prominence. Alveoloplasty is the term used to describe the trimming and removal of labiobuccal alveolar bone along with some interdental and interradicular bone, and is carried out at the time of the extraction of the teeth and after extraction of the teeth. Incision should be made on the crest of the alveolar ridge, usually the envelope flap. Releasing incision can be made on the labial side to provide broad space to the flap. Bony contouring is accomplished with bonifial pairs. Digital palpation can be used to determine the uniformity of the ridge. And mandible of bone resorption has been extreme. The mental foramen may open directly at the crest of the residual bony process. This causes the margin of the mental foramen to extend and have very sharp edge. Pressure from the denture against the mental nerve will cause pain. Removal of sharp ridge, knife edge ridge, bony prominence, undercut, and spiny ridge are usually removed to make possible border seal beyond them against the floor of the mouth. A sharp knife edge like a dentulous ridge causes aggressive denture irritation. It is usually found in the anterior part of the mandible. Place an incision on the crest of the ridge and elevate the mucoperiosteum as minimally as possible in order to maintain the vestibular depth. Irregular and sharp bony edges are trimmed to the depth 1 to 2 mm with the help of the ranger's bone file and pierce, and the wound is closed with silk suture. Reduction of genial tubercle. The genial tubercle are extremely prominent as a result of advanced ridge reduction in the anterior part of the body of the mandible. If the activity of the genioglossus muscle has a tendency to displace the lower denture, the genial tubercle is removed and the genioglossus muscle detached. Genial tubercle are the bony projection located on the lingual aspect of the mandible, two on either side of the mandible, which give attachment of the genial muscle. The two genial tubercles located superiorly are more prominent than the inferior one due to the gross resorption of the mandibular ridge. This may elevate the ridge lingually, giving a shelf-like appearance and making the anterior lingual seal impossible. Genial tubercles are exposed by blunt dissection using a bare chisel or rongers. The tubercle is removed and the rough bony margins are smoothed using file. Ridge extension procedure. Vestibuloplasty is a surgical procedure where oral vestibule is deepened by changing the soft tissue attachment. Vestibuloplasty can be done either on the labial or on the lingual side.
Assalamu alaikum. Augmentation visor osteotomy. This procedure is indicated to prevent and manage fracture of an atrophic mandible Visor osteotomy was described by Harley to overcome the resorption of a free-only bone graft. This technique is followed where the muscle insertion to the mandible and the nutrient supply is maintained. In this procedure, mandible is divided buccolingually by a vertical osteotomy from external oblique ridge of one side to the mandible to other side. The osteotomized lingual segment is pushed superiorly and fixed with the buccal segment using stainless steel wire in the lower border of the lingual segment. Mylohyoid ridge reduction is performed with a general anesthetic. Surgical remove liner incision is made over the crest of the ridge in posterior aspect of the mandible. Full thickness mucoperiosteal flap is elevated to expose the muscle. Bone file is used to remove the sharp prominence of the mylohyoid ridge maxillary. Excision of tori. Maxillary tori is congenital diagnosis exostosis usually situated in midline of the palate. Indication of removal: an extremely large tori filling the palatal volute. Interference with the function, speech, deglutition. Deep bone undercut, food ligament under the folds and projection of the tori. Procedure of surgical remove. Midline incision is given in palate and flap is reflected with Y-shaped releasing incision. Tori is removed by making multiple cuts of it, and the flap is sutured. 3A palatal supplement is given to prevent hematoma formation. Closure is performed with a resorbable suture. Mandibular tori is an exostosis found on the lingual surface of the mandible opposite the canine and the premolar region. Indication of removal: interfere with denture retention because of the loss of marginal seal in the premolar region. Large tori interfering with speech and deglutition. Tori causing lingual undercut and interfering with lingual flange. Extension of the planed prosthesis. Procedure if surgical remove. Bilateral lingual and inferior alveolar anesthesia is given. Incision extended from 1 to 1.5 cm beyond each tori is given. Always leave behind a band of tissue attached to midline between the anterior extent of the two incisions. The direction of the initial bear is parallel to the midline aspect of the mandible to prevent fracture of the lingual or inferior cortex. A bone file is then used to smoothen the lingual cortex. Continuous suturing is done and grass barks are placed and retained for the next 12 hours. Maxillary tuberosity reduction is excises horizontal and vertical bone or soft tissue in the maxillary tuberosity region may interfering with the denture construction. Management: if it is a small fragment, it should be surgical excised. A gingival incision around the involved teeth or raised a flap expose the bone with the tooth attached. Elevated mucoperiosteal flap proved adequate exposure to all area of bone excises. uh, wrongly used to elimination bone excesses, tissue reapproximation with continuous suturing technique. Soft tissue surgery. Labial frenum. It is the thin band of fibrous tissue covered with a mucus extending from the lip and cheek to alveolar periosteum. Simple excision, Vestibuloplasty and localized surgical technique, Vestibuloplasty. Lingual frenum. It is an congenital condition. The patient is unable to protrude the tongue, indication for removal. Speech difficult, prevent setting and irritation of the mandibular denture during speech or mastication. Epulos figuratum is a benign hyperplasia of fibrous connective tissue which develops as a reactive lesion to chronic mechanical irritation produced by the flange of the poorly fitting denture. More simply, epulos figuratum is where excess fold of firm tissue form inside the mouth as a result of rubbing on the ridge of denture that don't fit well. It is a harmless condition and doesn't represent oral cancer. Common techniques for removal of excess tissue include traditional removal with a surgical scalpel, electrical scalpel, or laser excision with a laser scalpel. Excision palatal papillary hyperplasia, mechanical irritation, poor hygiene, fungal infection, appear as a multi-nodular projection is palatal tissue. In palatal tissue, in initial stage, denture adjustment with tissue conditioner, electrosurgical remove, abroad with a rotating handpiece. Some patients require minor or surgical procedure before receiving a partial or a complete denture to ensure the maximum level of comfort. A denture sits on the bone ridge, alveolar ridge, so it is very important that the bone is the proper shape and size. If a tooth need to extracted, the underlying bone um, might be left sharp and uneven. For the best fit of the denture, the bone might need to be smoothened or reshaped.
And finally, thank you for your attention.